Hi, I'm Margaret Martin from Mueller Guide, and today's blog is going to be covering the challenges we have when we're looking at optimizing our weight bearing. And that comes into play with our cardiovascular recommendations that are on the Mueller Guide site. So I would like to bring up a client that I had this week who came to see me early postmenopausal 2 years ago. She had a bone density test, and it was telling her that she was osteopenic, so she wasn't too concerned. Unfortunately, she had another repeat bone mineral density test, so we're looking 2.5 years later, and it had gone down significantly, which is one of the reasons for her visit to me. Now, when looking at her history over the last 2.5 years, she had been a runner, and she was very active in her sport that she loved to do, but she had a slight injury, and she had some arthroscopic surgery, and had made a decision at that time that she was going to be kinder on her knees and start swimming and biking instead. She didn't realize the impact that this was going to have, however, on the integrity of the density and strength of her hip bones. And so having gone from always being a runner and loading down into weight bearing to being involved in non-weight bearing activities, good choice for her heart, good choice for her weight management, but not a great choice for her bones. And so here she is entering menopause, a time that we know you're losing a lot of bone because of estrogen decreasing, and she's also offloading or choosing cardiovascular exercises that are not stimulating bone building in the hip especially. And so the consultation with her was that her choices for going into biking and swimming were great choices in terms of knee health, but she needs to go back to supplement her walking now or her running that she had been doing. So a choice that she has, she doesn't have to go back to running because we know that brisk walking will have just as much benefit. She could also, if she's having difficulty, and some of my clients that might be carrying more weight or their ligamentous damage is a little bit more of a concern, they could be using Nordic poles or urban poles for walking because that helps offset the weight on the knee joint, but still allowing as much optimal loading through the pounding, that occurs with each step. And so as therapists, we're always challenged to find the best bone loading with the most joint preserving activity possible. And so as a therapist, if you are, having to brush up on your knee anatomy, I would recommend a course that's just come up through MedBridge, so something you might want to consider. But certainly, when you're interviewing your clients and you're looking at the pathology of a particular joint, I encourage you to think past the joint and look at, what is the bone health or the skeletal health going to be like in 6 months, a year, 2 years, based on your recommendations, because your recommendations might be really solid for right now. But just encourage them to be thinking about, that transitioning back to more loading. So that's all for Mueller Guide today. Thanks for tuning in.